Good day. My name is Dr. Tatiana Prokopia, and today we will discuss about essential of pathology anatomy. At the last lesson we talked about acute inflammation. Today we will discuss about chronic inflammation. Pay attention, it's not all full information for this topic, it's only essential of knowledge for the about chronic inflammation. Let's go.
Разведение.
Информационная технология обеспечивает.
Начинаем очередную лекцию.
So, you remember that inflammation is a complex stromal vascular response to ensure leads to eliminating the injurious agents to the repair of damaged tissue. Inflammation underlies many diseases and can cause death. Negative effects of inflammation are based on the fact that it may be accompanied by suppression of the tissue with the formation of fistula and massive scarring. Inflammation direct to Inflammation is a protective and adaptive reaction direct to the elimination of area of damage, destruction of agents that cause inflammation, restoration of damaged tissue repair. Inflammation may be acute, subacute, and chronic. Morphological types of inflammation: alterative, exudative, and productive. Today we will discuss about productive inflammation. So, proliferative or productive inflammation. Proliferative inflammation is characterized by a predominance of the processes of histogenous and hematogenous cells proliferation. Etiology. Etiology of proliferative inflammation. Productive inflammation may be caused by primary biological, physical, and chemical factors and the background of special reactivity of the organism, as well as can be observed following a transition of acute inflammation into the chronic, healing of ulcer, abscesses, etc. Also, this inflammation occurs in case of the persistence of the injurious agents due to imperfect exudative reaction, often caused by the defects of polymorphonucleus leukocytes, or due to the special characteristics of the causative agents in complete phagocytosis. Localization. Morphology: there is formation of diffuse or focal infiltrate consistence, primary of macrophages, lymphocytes, and plasma cells, which are often located in the interstitial tissue, such as interstitial pneumonia. Outcomes. The most often outcome of the proliferative inflammation is sclerosis, with the development of atrophy and skin cage of organ, cirrhosis. There are 4 types of proliferative inflammation: interstitial inflammation, granulomatous, hyperplastic growth, inflammation around the foreign bodies, and parasitis. Interstitial proliferative inflammation. Etiology. Etiology of interstitial proliferative inflammation occurs due to the chronic viral infection, autoimmune processing, or long-term chemical intoxication. Localization: interstitial inflammation. It occurs in the stroma of parenchymal organs such as heart, myocardium, liver, kidney, and lungs. Organs are changed slightly, slight increase in the size, irregular of the blood filling, the flabby consistency can be observed. There is a focal diffuse inflammatory cell infiltration in the stroma of the myocardium, liver, kidney, and lungs, pronounced dystrophic and sometimes necrobiotic change. Can be found of the parenchyma of the organs. Outcomes and complication. Typical outcomes of diffuse growth of the connective tissue, which can lead to organ dysfunction. So, the outcome of the interstitial myocarditis is diffuse cardiosclerosis, leading to chronic heart failure. Interstitial lung disease often leads to interstitial pulmonary fibrosis, with formation of the so-called honeycomb lungs, and advanced cardiopulmonary disease. Interstitial sclerosis, which is accompanied by organ deformation and damage of the parenchyma blood vessels, is known as cirrhosis. Hepatic cirrhosis, cirrhosis of the lung, nephrocirrhosis, etc. Granulomatous proliferative inflammation. Granulomatous proliferative inflammation is a form of chronic inflammation in which the nodules and diffuse tissue infiltrates are formed. The predominant cell types in the cell infiltrates are cells of monocytes, macrophage organ, macrophages, epithelioid cells, gyn, multinucleate of granulomas. Due to etiology, we know infectious granulomas, associated with bacteria, viruses, rickettsia, protozoa, chlamydia, and others. Next is non-infectious granulomas, around foreign bodies such as particles of organic or inorganic dust. Unknown etiology granulomas, sarcoidosis, Crohn's diseases, primary biliary cirrhosis, and others. Due to pathogenesis. Due to pathogenesis, we know immune granulomas, they are the most of infection granulomas that occur around the dust particle of plant or animal organs. Granulomas in infectious disease reflect the reactive resistance of the organism against the pathogen non-sterile immunity. Morphologically, they are usually epithelioid cell granuloma, or can be built from macrophage and contain gyn paragophlangane cells, as well as admixture of a large number of lymphocytes and plasma cells on later stage fibroblasts. Non-immune granulomatous proliferative inflammation. They are the most of granulomas around foreign body, consisting of particles or inorganic dust, subtle material of parasites. Morphologically, gyn cells granulomas can be seen consisting of macrophages and gyn multinuclear cells of foreign body. In comparison to the immune granulomas, there is minimal number of lymphocytes and plasma cells. Due to cellular composition, we know macrophage granulomas, epithelioid cells granulomas, gyn cells granulomas, and mixed granulomas, cells of different types. Due to morphology, morphogenesis, non-specific, specific. Morphogenesis is granulomas, morphogenesis. Classification of granulomas due to the cellular composition reflect morphogenesis of granulomas, which consist of 4 stages. One of them, accumulation of monocytes in the inflammation area. Second, transformation of monocytes into macrophage granulomas. Next is transformation of macrophage into epithelioid cells. Transformation of the epithelioid cells into the gyn cells. It's called gyn cells granulomas. Epithelioid cells has a large pale oval nucleus and pale pink granular cytoplasm. They are usually don't form secondarily with the sun, inducing a low phagocytosis activity. At the same time, these cells have well-developed route in the plasmatic reticulum and are synthesized various cytokines, stimulating sclerosis process in tissue. Schematic representation of the granuloma by morphology may be specific, non-specific. If we say about non-specific granulomas, these granulomas don't have distinctive morphological features. Etiology. Example is inflammation around the foreign bodies and parasites of the animal origin, such as alveococcus in liver. The liver is enlarged and alveococcus occurs a large part of the liver. It is represented by the white dense node without clear boundaries resembling a tumor. Infiltrative growth of alveococcus explains its distribution through the vessels to the lungs, brain, and other organs, whereas the secondary nodes could be found. Alveococcus sites are surrounded by chitin shell that is intensely colored in pink. Around is the necrosis area with the presence of granulomatous inflammation with an abundance of Gann cells of foreign bodies, lymphocytes, plasma cells, and fibroblasts. Outside the connective tissue capsule is formed. Outcome: non-specific granulomatous inflammation. Outcome is alveococcus died, the cysts become petrified. Next, we say about specific granulomatous granulomatous inflammation. Specific granulomas are associated with specific pathogens. Mycobacterium tuberculosis, tuberculoma, Mycobacterium leprosae, leproma, Treponema pallidum, gumma, Klebsiella rhinoscleromatoses, scleroma. All 4 types of granulomas occur in disease that have chronic undulating course, with periods of exacerbation and remission. Morphological specificity is relatively. Therefore, it's necessary to take into account the results of clinical, bacteriological, immunohistochemical, serological, and other studies. Tuberculoma. Localization tuberculoma is we observed during the course of tuberculosis of the lungs and other organs. There are numerous white to yellow small grain-sized foci in miliary tuberculosis in the lungs tissue. Numerous granulomas can be seen. There is a small area of caseous necrosis in the center, which is surrounded by epithelial cells and giant multinuclear pyrogoth Langerhans cells. When stained by Zelle-Nielsen, Mycobacterium tuberculosis can be detected. Lymphocytes and locate in the periphery of the granuloma. There are no blood vessels in tuberculoma. Outcome of tuberculoma. Tuberculoma is favorable of the granulomas is scar formation and hyaline change, and for caseous necrosis, petrification. Unfavorable course lead to increase of exudative and necrotic change with the development of infiltrative and destructive forms of tuberculosis. This results in pulmonary or respiratory failure and fatal abrasive bleeding. Often, disease is complicated by the development of cachexia and secondary amyloidosis. Gumma. Gumma is atypical for certainly syphilitic infection that occurs several years after invasion. Localization. Localization gumma can be localized by different organs and tissue, bones, skin, liver, brain, etc. In ceteris syphilis, its addition to gumma, diffuse granulomatous inflammation may be observed gummatous infiltrate. There is a node from 1 centimeter on the skin to the size of chicken eggs into internal organs. On the section, there is yellow jelly-like mass that look like Arabic jam. There is caseous necrosis in the center, which surrounded by the granulomatous tissue with numerous lymphocytes and plasma cells and a mixture of epithelioid cells, fibroblasts, and zinc pyrogoth Langerhans cells. The distinctive feature is the presence of a large number of small blood vessels with productive endovasculititis. Peripherally connective tissue capsule is formed. Outcome of gumma. Scar formation in the presence of multiple gummas around the formation of the organs. Leproma. Leproma etiology, Mycobacterium leprosae. About localization, mainly leprosy granulomas occur within the skin. Granulomas and leprosa have a different structure depending on the form of the disease. There are several variants of the leprosis, including from with a high resistance on the host organism, tuberculoid leprosy, and from with a low resistance of the host organism, lepromatous leprosy. Tuberculoid form of leprosy is clinically benign and sometimes self-healing of the background of marked cellular immunity. Diffuse skin lesions such as a papules and plaques with subsequent depilation lesion. Change in the internal organs are not typical. There are epithelioid cells, granulomas, and mycobacteria are detected in rare cases. It confirms the delayed type hypersensitivity mechanism of the leprom development. Nerve damage is characterized by diffuse infiltration with epithelioid cells, which is manifested by early sensory symptoms. Lepromatous form of leprosy is characterized by the development of diffuse granulomatous inflammation. The skin lesions have a diffuse character. There is a damage of skin derived, sweat and sebaceous glands, as well as blood vessels. Diffuse infiltration of the skin sometimes leads to complete disfigurement, lion face. Granuloma consists of macrophage, epithelioid, plasma cells, and lymphocytes. It is characterized by the presence of leprosy. Virchow cells, leprosy balls that are the giant cells with vacuolar cytoplasm. Using Zelle-Nielsen staining, Mycobacterium lepra can be detected, which are packed as a pack cigarettes. Outcomes of leprosy in case of effective treatment, they are favorable. It's possible up to a complete cure. Unfavorable outcomes are associated with the destruction of tissue, with the formation of ulcer, large areas of necrosis up to mutilation, out to amputation of body parts. Next is about scleroma. Scleroma localization. Inflammatory infiltrate is located in the mucous and skin of the vestibule of the nasal cavity, nasopharyngeus, Howans, larynx, trachea, soft and hard palate. There is diffuse or nodular thickness of the skin and mucous membranes, and nuclei have a soft consistency and subsequent secure cartilage inside do not prone to ulceration. The mucous membrane lesions are bright pink or dark red in color, and dilation and solid infiltrate is a granulation tissue with the capillaries and accumulation of macrophages, lymphocytes, large number of plasma cells, and there is degradation products, eosinophilic Russell bodies. Specific feature of the scleromas is very large mononuclear cells which vacuolate cytoplasm. It's called Mikulicz cells, in which pathogen can be identified: Volkovich-Virchow bacillus, Klebsiella rhinoscleromatosis. Outcomes of scleroma. Outcome of scleroma: rapidly undergrow sclerosis and hyalinosis that leads to stenosis and sometimes asphyxia. Next is about hyperplastic growth. Hyperplastic growth is polyps and condylomas. Comparative characterized by hyperplastic growth of the form polyps and condylomas presents below. Comparative polyps and condylomas. Etiology: polyetiological polyps. Condylomas is human papillomavirus infection. Localization: polyps, mucous membranes, stomach, colon, uterus, etc. Localization: condylomas, at the border of the columnar and squamous epithelium, external genital organs, and skin of the perineum perineal region. Macroscopical polyps, fundiform of papillary exhaustive outgrowths on the mucous membranes on the pages of the white bases. Lesions on the skin with a lobe structure in the form of a cauliflower or cockscomb. Pink in color on the peduncle or the wider bases from a few millimeters to dozens of centimeters. Guillain-Barré condyloma. It differs between papilloma and guttiloma. Microscopical polyps, growth of hyperplastic epithelium. Peduncle is formed by the connective tissue with vessels. Condylomes, villous proliferation of the stroma, covered with squamous epithelium with acanthosis. Outcomes. Polyps, inflammatory process, malignization. Outcomes with condylomes to inflammatory process, malignization. Next, about inflammation around the foreign body and parasites. Inflammation around the foreign body and parasites. Etiology. Etiology is animal parasites, even dead and foreign bodies which are located inside the parenchymal organs or tissue cannot be phagocytosis or eliminated. Therefore, the productive inflammation is formed around aimed at the elimination of these agents by a connective tissue capsule. The inflammatory infiltrate around the intramural animal parasites, Alvecoccus, Trichinella, and cystic cirrhosis contain eosinophils, lymphocytes, macrophage, fibroblasts, and Guillain cells of foreign body. The outcome of inflammation is the formation of the connective tissue capsule. If the parasite is habited with bile or pancreatic ducts, epistarchosis, bowel or urinary bladder, schistosomatosis. The productive inflammation develops in the wall of these organs. The walls become infiltrated by lymphocytes, plasmacytes, and eosinophils. The inflammation involves mucous epithelium forming the reactive proliferation which may lead to malignancy. The outcome of inflammation is sclerosis and deformation of the wall of ducts, bowel, or urinary bladder. The character of inflammatory reaction around the foreign body depends on the types of insoluble foreign body. It may be coal, asbestos, metals, talc. Inflammatory infiltrate composites primarily of macrophage, and the end formation of connective tissue can be seen. Plastic sponge structure, material, beryllium, and detail acute inflammation with leukocyte happens followed by quickly. Appearance of macrophage and guide cells of foreign body with the formation of the connective tissue. It was all what I want to say about chronic inflammation today. Today we discuss about chronic inflammation. In next lesson we discuss about compensatory and adaptive process into the body. Have a good day. Goodbye.